Welcome to Trauma Informed Vaccine Conversations with the Washington State Department of Health. Today I'm joined by clinical psychologists Dr. Kira Massa, Dr. Tona McGuire, and Dr. Michelle Andrasik for a discussion about trauma-informed vaccine conversations during the COVID-19 pandemic. Dr. Andrasik, why is it important to use a trauma-informed approach with patients when they're getting vaccinated?
Well, I think, there are a number of reasons. First of all, there's quite a bit of trauma that people experience in lives, particularly among marginalized communities and communities with devalued identities. And often this trauma starts as early as childhood. And, then there are traumas experienced throughout the lifespan. So it's really critical that we understand the effects of violence and abuse on a person's life and development. And an understanding of those effects, can lead one to really base their practice on strengths or empowerment models, and, focusing on strength-based empowerment models can foster growth and helps recognize and promote resiliency. I think, one of the things that's really critical for me is that people who operate from a trauma-informed care perspective understand that behaviors that we have traditionally viewed through a pathological lens are often a person's attempt at coping. And those attempts at coping may or may not result in the outcomes that individual desires. So, ensuring that we are creating welcoming and empowering spaces that recognize trauma, not only increase people's access to choice and options, but also increases sort of a sense of control over life decisions, which is the exact opposite of trauma, because trauma often makes people feel out of control and at a loss for options. So it's really critical that we acknowledge that people who have histories of trauma are way more likely to experience particular treatment procedures and practices as negative. The way that they're talked to, the way that they're treated, or how much we attend to them. And this could be reminiscent of specific characteristics of past traumas or abuse. And, we are, if our environments are not welcoming and affirming, then we can potentially re-traumatize individuals. So, and that basically means that, they're feeling like their past trauma is reoccurring, or if, the treatment or the intervention that we are trying to administer is as dangerous and unsafe as past traumas. So I think it's really critical that we increase our awareness of trauma, understand what trauma symptoms look like and how they can manifest in practice settings, and ensure that our settings are affirming and welcoming and not creating situations where we can re-traumatize individuals.